Hello, my name's Dr. Irtazar Qureshi, and this is a video abstract for a poster presentation on mental health during COVID-19, which is a qualitative study with ethnically diverse healthcare workers in the United Kingdom. In terms of background to this study, we know that healthcare workers globally have reported experiencing a deterioration in their mental health due to COVID-19. Alongside this, we also know that ethnic minority populations in the United Kingdom have experienced a disproportionate detrimental effect of COVID-19. We do not have a great deal of information on the lived experiences of ethnically diverse healthcare workers in the United Kingdom during the pandemic. In terms of methods, we undertook a qualitative approach to this study, which was part of the United Kingdom research study into ethnicity and COVID-19 outcomes among healthcare workers, or UK REACH. We carried out 16 focus groups as part of this sub-study, with a total of 61 participants. During these focus group discussions, we tried to explore participants' experiences, fears and concerns, and perceptions about safety and protection while working during the pandemic. The sample included various healthcare workers of different ethnic backgrounds, including doctors, nurses, midwives, allied health professionals, ancillary health workers, and others. The findings and the results from these focus groups can be seen in this diagram here. You can see several factors were identified which had an impact on the mental health of healthcare workers. These included anxiety due to inconsistent protocols and policy, fear of being infected by COVID-19, trauma due to increased exposure to both severe illness and death in personal and professional capacities. There was guilt of potentially infecting loved ones and increased stress due to longer working hours and increased workload. These findings are important because many of our findings align with the existing evidence base. Our findings from our research also suggest that the organizational responses to the pandemic were inconsistent, and this lack of clear and consistent guidance did leave healthcare workers at risk of physical as well as mental harm. There are specific circumstances which relate to the experience of ethnic minority healthcare workers, and our research suggests that, again, aligning with other research which identified less access to adequate personal protective equipment for ethnic minority healthcare workers, for example, these circumstances have led to a lack of trust in employer, which may lead to fundamental sense of betrayal. And this lack of trust and sense of betrayal has been measured in the past using the moral injury event scale, for example. The cumulative effect of this experience may well have a detrimental impact on the mental health of ethnic minority healthcare workers. So in conclusion, it's critical that healthcare workers are better supported by healthcare organizations. Healthcare organizations can use some of our findings to better inform them of the factors which may be contributing to the deterioration in mental health in ethnically diverse healthcare workforces. Healthcare organizations should consider developing strategies to counter the negative impact of these factors.